Hello, good morning. Welcome back. This is Module 14 with me again, Doc Ivy. Module 14 is on the Disease Surveillance Reporting System. We will talk about collection, analysis, reporting, dissemination, and utilization of data. The learning objectives for this module are as follows. First, we want to define and understand what is school health surveillance. Second is to differentiate active and passive surveillance. Third is to understand the components of data analysis in the context of school health surveillance. Specifically, first, we will create school health surveillance objectives using case definitions. Second, we will talk about principles of data collection and how to prevent common errors. Third, we will emphasize also the importance of data validation and how exactly is this done. And then lastly, we will exercise data analysis, building on what we've learned from Module 13 to present. So what is surveillance? Surveillance is an essential function of public health. It is carried out to monitor changes in the number of prevalent and incident cases, as well to monitor the risk factors and protective factors for diseases. This monitoring is traditionally thought of to be done for infectious diseases, but it is also used to check on non-infectious conditions as well, such as mental health issues, asthma, cancer, hypertension, and diabetes. In the Philippine Department of Health, the regular COVID-19 case bulletins include new cases or incidents, active cases or point prevalence, total cases or cumulative incidents, as well as vaccination coverage or protective factors. It also includes healthcare utilization indicators. Let's take a look. So this is the regular weekly case bulletin of the Department of Health. And as we know, there is really the surveillance part here, which is the number of cases, the new cases, the active cases, and they even disaggregate by severe and critical cases, and also they report the death counts. But apart from the actual cases, they also put in the protective factors or their targets, which is on vaccination, and the, in a sense, the clinical outcomes, which is healthcare utilization. And down below are, well, no longer surveillance related, but just helpful information for the general public. Surveillance is also defined as the continued watchfulness over the distribution and trends of incidents through the systematic collection, consolidation, and evaluation of morbidity and mortality reports and other relevant data. In a school setting, the context would be the morbidity or diseases affecting students, school teachers, and all other people directly involved in daily school operations. So when you think about surveillance, we're not just talking about the students, okay? We're talking about everyone in the school. Again, surveillance is not limited to COVID-19, okay? So in a school setting, we can include other common childhood illnesses. That depends also on your province, on what is the local epidemiologic picture. So, but generally, common childhood illnesses may include things like upper respiratory tract infections, acute diarrhea, head lice, dengue, chickenpox, malnutrition, and so forth. So why do we do this? Why do we conduct surveillance? The most common reasons for conducting disease surveillance is for planning, implementing, and evaluating public health policies and practices. In this pandemic, we want to be able to do surveillance so we can ensure a safe environment for our students as we resume face-to-face classes. School health surveillance allows us to, number one, see the big picture by monitoring disease trends in the school population. Number two, identify and target those with the disease or those who are at risk for the disease. Number 3, support health planning to determine effective control measures. And number 4, make important and urgent decisions for school reopening, school closure, and school reopening again, if needed. Now, I just want to state here that in this module, we will refer to surveillance, disease surveillance, and school health surveillance interchangeably. All three terms refer to the systematic monitoring of incidence and prevalence of diseases in children and adults in a school setting. There are two types of surveillance, active and passive surveillance. You see, surveillance can be performed in various ways. This will depend on how you will design your reporting systems. It should be designed to fit your current attendance and daily schoolwork routines. You do not need high-end software or technology to implement surveillance. In the same manner that you are able to monitor the grades of your students, you can also monitor the general health states of your students and your colleagues in school. Surveillance is classically categorized as active and passive surveillance. However, with ever-changing health information systems, sometimes it is difficult to differentiate active from passive surveillance measures. But in this module, we will focus on very basic, easy-to-do surveillance measures that are feasible in the school setting. As the term suggests, an active surveillance program entails proactive case finding by the authorities, usually government-related, or maybe in your setting, the school administration, while a passive surveillance program is to monitoring the reports coming in from clinics, laboratories, or by the cases themselves or patients themselves. Surveillance, though, ideally is a combination of both active and passive approaches to capture a timely and complete picture of the burden of disease in the target population. Active surveillance denotes programs or policies wherein designated personnel makes regular visits or checks in with its community, regardless of current case numbers. This can include interviews with healthcare staff, regular auditing of clinic charts, surveying households to check whether there are any reports of the specific disease or condition of interest. Active surveillance requires more resources than passive surveillance, and therefore is usually more expensive, but provides timely and accurate data. Yes, as mentioned, there are plenty of examples of active surveillance in a school setting. So here we have surveys of regular health status, proactive follow-up of absent students, or observe whether any of the students present with symptoms. Going to classrooms and asking whether anyone is feeling unwell, checking whether any of the students have family members who are sick. Passive surveillance, on the other hand, relies on reports coming in from the cases themselves, or self-reporting, or based on existing data available. This is generally less expensive, but may also be prone to under-reporting or delayed reporting. Now, missed cases will lead to small numerators and would result in low prevalence and incidence only by the report and not being very accurate. So, in a school setting, how can passive surveillance be done? So, examples of processes involved in passive surveillance include waiting for families or employees to report symptoms, or waiting for students to visit the clinic when they are unwell, or just passively waiting for positive findings from routinely collected health data.